Hello, this is Deborah from CerecConnectLab.com. I'm bringing you a video to introduce Cerec design on tooth number 3. After the images of the prep, the bite or occlusal view, and the antagonist are loaded, click on the green forward arrow located on the panel to the left. This can take a few minutes to correlate the images. Take note that in this particular file, there's 3 images of the prep, 3 of the occlusal view, and 3 of the antagonist. If you take several pictures, say 10, this would take longer to correlate the images. If you look at your views that you've taken and you want to narrow down the selection, you can drag and drop excess views into the trash can. The first thing, once this is loaded, it's going to ask you to set your parameters. This actually is where you would adjust your spacer thickness for your cement, your contact tightness, and your occlusal contact adjustments. A file should be kept for each doctor and have his preferences indicated. When you're done with your selections here, hit the forward arrow again. You can use the tool selection panel on the right to reduce any heavy contact areas on the occlusion. The first thing that you're indicated to do here is you want to trim your die. Always in the lower left-hand corner, it tells you which step you're working on. Use your trim tool, double-click, draw your line in approximately. When you arrow forward, now you're going to be asked to mark your margins. Once you've done that, you're going to also trim your antagonist or bite registration. Then choose which tooth anatomy design you want to follow. Individual will actually pick up the occlusal design of the teeth next to it, or you can choose youth or adult or any of the selections there. That forward arrow again will introduce your design for you. Once this step is completed, you can see that there is a red mark where the occlusion is heavy. You can use your adjustment tools here to reduce that red mark so that it is green, which indicates acceptable occlusal contact. Also, by using the add tool, you can tighten up your marginal ridge area or your interproximal contact areas, broaden them if this is the preference of the doctor. You also can do some adjustments on even the anatomy. You can adjust your cusp tip height. Always rotate your model around and look at your emergence profile, cusp tips. Once this is done, you'll be asked to choose your material that you want to have this unit milled out of. Select what material you're going to use, and then arrow forward. This is where you can actually see this design in the block. How it fits in the block that's going to be put in the mill machine to mill the case. You can adjust the size if it looks too tight, or it will indicate to you if it is not available to mill it out of smaller sizes. When there's the block and the design viewed in the block with your screw. This is Deborah again. Bye for now.